In 1958, physical therapy was defined by the World Health Organization as the science of medical treatment through physical means, therapeutic exercises, massage therapy, and electrotherapy. From its inception, physical therapy has been developing differently in different places around the world. Multiple points of reference concur in determining that physical therapy was and continues to be the preferred treatment protocol for multiple maladies. It is currently performed on humans as well as on animals. Physical therapy for animals seeks to improve the well-being of pets, and it expands the therapeutic options available to treat their ailments. Today, dogs, as well as cats and other domestic animals, can receive targeted care within a professional and rigorous context.
I have been a faculty member of the University of Antioquia's veterinary hospital for 6.5 years. And we've been working on physical therapy for 5 years in the area of therapy and rehabilitation of small species. To start off, why did I become a veterinarian? Because I love animals. It's my passion. I chose to research the field of physical therapy because I enjoy working on rehabilitating patients to help them walk again. Patients that come out of surgery and need rehabilitation. Patients suffering fractures, patients with problems with the spine. I think it's beautiful to see them evolve and hope that they can walk again and return to their normal functions. Physical therapy is the science of rehabilitating patients coming out of surgery. It's the application of physical tools on patients so that they can get back to their normal life. It is used on patients coming out of orthopedic surgery, patients with spinal column surgery, or those suffering from muscle or ligament injuries that require intervention so that they can return to their normal state.
Dr. Carlos Diaz also talked to us about the countries that are pioneers in this field and about how relatively new it is in Colombia.
Physical therapy for animals is the piece of the puzzle that surgical patients were missing. Those patients coming out of surgery from fractures or spinal column patients. Physical therapy started a few decades ago in the United States, Spain, and Argentina, which have been the pioneering countries in this field. In Colombia, it is fairly new. We have been doing it for more or less 10 years.
Physical therapy has a beneficial effect, not just on injured soft tissue, but also on the joints and the bones. That's why it's important to mention some of the goals of physical therapy and rehabilitation in animals.
Elimina la causa de la alteración física. Mejora los síntomas clínicos para retornar a su función normal. Alivia el dolor. Reduce la inflamación. Mejora la buena forma cardiovascular. Mejora y prolonga la calidad de vida del animal.
Let's now learn about some of the elements used in animal physical therapy sessions to help in their rehabilitation.
In physical therapy, we use physical tools that help in patient rehabilitation. You can use magnets, ultrasound, lasers, and everything that has to do with electrical stimulation. The magnet is normally used to help with the pain. It is a tool that helps to relieve pain, just like the laser. The laser helps to stimulate and regenerate, and it also helps with the pain. There is also electrical stimulation, which helps to recover atrophied muscles, muscles that are small or that need to increase in mass. With electrostimulation, you can also perform electroanalgesia, meaning that through electricity, you can manage pain.
The results obtained in post-surgical rehabilitation in human beings have been very positive, and for that reason, it was implemented in animals a few years ago. And even though the techniques are performed in a similar way, there are some differences that Dr. Diaz spoke to us about.
The basics of physical therapy are the same, but there are some differences with regards to the patient. It's not the same treating a human being who is aware of what's going on as treating a dog or a cat. They are resistant to the procedures at first. They have to remain still against their will, and they don't like being touched by instruments. We normally apply electrotherapy. That is, we stimulate them with electricity, and that is new to them. So we often run into patients that make the procedures difficult to perform, but the principles of physical therapy are the same.
Dr. Carlos Diaz also told us why it is necessary to perform physical therapy sessions on animals that have recently undergone surgical procedures.
All patients coming out of surgery need rehabilitation and physical therapy in order to accelerate the healing process, to make it faster and more efficient. Patients that don't get physical therapy often don't heal correctly, or they can take longer to heal, or they can get additional injuries that can generate complications.
Let's now look at two cases where patients needed to undergo physical therapy after surgery in order to heal completely. Kiara arrived at this home 9 years ago. At that time, we were grieving the loss of another dog that had died. Her death was a tragic case of accidental poisoning. Our daughter wanted another pet badly. She wanted a pet to greet her when she got home from school. So her father and I decided to get one, and we went ahead and bought a chocolate lab that we named Kiara. She got here 9 years ago on August 9th. She became a beacon of joy for us. We spoiled her a lot. She was very destructive when she was a puppy, but we raised her with a lot of love and a rolled-up newspaper. Kiara brought a lot of happiness to our home. I took her for walks. She waited eagerly for the kids to return home from school. And Kiara paid special attention to our daughter. Then we got her 2 other dog buddies, Saori and Simon, who also keep me company.
Dante.
We had a Siberian wolf who developed renal failure, and the dog was nearing death. That was very difficult. So Dad gave our son, Sebastian Dante, as a gift. They had told us he was 2 months old when we bought him, but in reality, he was just a month old. He looked like a beautiful cotton ball. I say that they tricked us because we were looking for a medium-sized dog. And if they had told us that he was just a month old and since he was already big, then we would have known he would grow to be a giant like he is now, and surely we wouldn't have taken him. He filled the void left by another pet, and he filled our house with love. The owners also talked to us about the personality of their pets and how they became aware of their illnesses. Kiara had been showing signs of aging. She had been very restless, very destructive, and spoiled when she was a puppy. Afterwards, she became very calm and happy. She would get very happy when we arrived at home, and she was a happy companion. And she loved going on walks. Then I noticed a change this year, and she became like a dour old lady, maybe because of the pain she was feeling. I first noticed signs of Kiara's pain and illness earlier this year, when I began to notice that she would hesitate to go upstairs. if she was on the bottom floor. She would look up as if saying, "Do I go up or not?" I was very attentive to any change, and I would observe her carefully. And as the days passed, we maybe didn't think it was anything serious. But I became afraid that maybe it was dysplasia. And so we took her to the clinic. They examined her, took x-rays, and then she was diagnosed with the illness. Truthfully, this dog is extremely obedient. He is a very intelligent dog. He has been wonderful. This dog takes care of all the members of the family. Even our 3 cats, as incredible as that might seem. He takes care of this entire family circle: cats, children, adults, and the elderly. After learning about physical therapy in animals and how Chiara and Dante arrived at their respective homes, we learned about each animal's case and their respective treatments.
Each physical therapy patient has a unique set of conditions, depending on the type of surgery that was performed and what their pathology is. The diagnosis is very important.
Chiara's case.
Chiara is a 9-year-old patient that was diagnosed 4 months ago with bilateral coxofemoral osteoarthritis. Doña Piedad, when was she operated?
On September 2nd.
The surgery was performed on September 2nd. We performed an arthroplastic incision at the head of the femur. That consists on taking off the head of the femur, which diminishes pain in the area. Chiara arrived in pain. She was a patient with a marked limp, and although we have not yet seen significant changes, we notice that the stability of her leg has improved. It does not shake as much. We can see that she is a quiet patient. She allows us to perform physical therapy with ease. This is her 4th physical therapy session. She is a patient that knows that we can reduce her pain here. We are using equipment to manage the pain, and she knows that we treat her well here. Doña Piedad, have you noticed any improvement since the surgery? That is, have you seen any changes since the surgery?
At least the fact that the surgery is already done is an improvement. I expect to see a lot of improvement after the therapies have run their course. She is still in pain because of the surgery, but she's healing internally. I can see that her disposition has improved. Now she wants to spend time with us and come to the door. You can see that even though she's still in pain and undergoing physical therapy, the pain is not as bad as it once was. We used to say that she had become bitter because you could see that she was always in pain and her face was sad, almost bitter. Dante's case.
Dante underwent surgery on his spine. He was operated because he had a condition called cauda equina syndrome. It is a condition that affects the spinal column, and for these patients, we seek to diminish movement right after surgery in order to avoid additional injuries and complications.
Before the surgery, he had been diagnosed by another vet as having mild hip dysplasia. And last year, he started treatments for that. Starting in April, I started to notice that he looked sad, sullen, and he didn't want to walk. At first, I thought that it was because of his age, since people told us that he was an old dog, but he hadn't turned 8 yet. So I brought him to the University of Antioquia to see an orthopedist. That was around May. Dr. Riaño told me, "That's not a case for the orthopedist. It's not dysplasia." That took me by surprise, because he made him walk and he said, "The problem is not in the hips. It's the spinal column. Before the surgery, the dog was very down. He was depressed and crying in pain. The truth is that the dog could not stand on his own. It pained me to see him, so I made up my mind and we decided to perform the operation. From the first day, I noticed a positive change. The truth is that he had become a pitiful sight. At first, he walked slowly with his legs open. We followed the vet's recommendations. He couldn't run or walk fast, but the change was radical. And 8 days after starting physical therapy, the change has been fabulous. I say fabulous because you can see the dog's energy and vigor, the desire to run and jump, of having the life he had a year and a half ago. Here are some points to keep in mind regarding physical therapy for your pets.
It's important for owners to understand that physical therapy is a means to help their pets. It is not a procedure that will induce pain. On the contrary, we use tools that will help them live their lives well and with dignity.
Dr.
Carlos Diaz also made a very important recommendation for pet owners to understand the importance of preventative medicine and the commitment of owning a pet.
One of the most important recommendations I can make is to adhere to preventive medicine. That is, we should prevent illness so that it doesn't have to come to surgery, so that they don't need physical therapy. We have patients that end up here because of the owner's carelessness, who don't use a harness or who let them go to the park without any precautions. Dogs have no control and they can go out on the street and get run over by a car. Patients who survive that and don't die can have very serious injuries, spinal column injuries that won't let them walk again, or injuries to limbs that can lead to them being amputated. These are events that can be prevented starting at home.
I say that the rehabilitation process is about patience. 1 or 2 therapy sessions won't suffice. Just as one animal may recuperate with 5 or 6 sessions, another may require 15 or 20, depending on the injury and how it's managed and what kind of care you're giving to the animal. So I say you have to be patient and follow all of the recommendations given by the therapist, because that is what is best for the animal, so that you don't lose all the work you've put into them. So I say you have to be consistent with the treatment and with all of the therapies and everything else the animal requires.
It's also important for owners to understand that the commitment starts at home as well. We usually prescribe exercises and thermotherapy, the application of heat or cold, to further treatment along. We can't spend all day doing physical therapy on a dog at the clinic. The owner has to help the animal at home with the healing process.
Finally, Doña Piedad and Doña Blanca told us what it means for them to own a pet. For me, having a pet means so much. In my case, they keep me company more than my children, since they work far away. So Kiara is my companion. She was at my side when my husband passed away, and she was laying at my feet saying, "I'm here." So really, Kiara is like a daughter to me, because she knows that I love her very much and that I'm talking about her. She knows she's very spoiled. In other words, she's my best friend. In other words, I haven't found another being as faithful as Kiara.
Es mejor dicho, la amiga. Mejor dicho, yo no encuentro otro ser más fiel que Kiara o las mascotas. Yo pensaba.
I thought that when Kiara was gone, I would get another pet. I'm particularly fond of golden retrievers.
Pero en lo que estoy viviendo con Kiara.
But given what I am now going through with Kiara, all the surgeries, the fact that she could suffer complications, that she's getting old, I really question that sometimes. Because having a pet implies a lot of responsibilities.
Porque es la responsabilidad que uno conlleva el tener una mascota.
I used to say that everything in life has a purpose, but now I don't know.
Ahora me cuestiono. Pero lo más posible, como quiero tanto las mascotas, me gusta, son tan.
But since I love pets so much, and they're such great company, I would probably get another one. If Kiara were gone today, most likely I would get another pet, since they bring so much joy to the house. The change has been absolutely radical, and I recommend to people that if their dog develops this type of problem, they should do it, because the improvement is drastic. A pet is another member of the family. I love this little guy a lot. And only people who have pets at home, know all that a cat or a dog may mean to someone. They're another member of the family. And if you have one, you have to be ready to fulfill all of the responsibilities that come with it. Not just to feed them or love them, but to provide them with medical care when they need it. That is part of adopting a pet. There is a responsibility that we as humans have towards other living beings that keep us company and make us happy.